I'm Jacob Jenser. I'm an assistant professor and the director of cardiac intensive care unit research at Mayo Clinic Rochester. I would like to tell you about our research efforts highlighted in the upcoming Mayo Clinic Proceedings article, Admission Braden Skin Score Independently Predicts Mortality in Cardiac Intensive Care Patients. The primary message from this study is that the Braden Skin Score, a simple clinical tool documented by the bedside nurses as part of pressure ulcer prevention, is a powerful predictor of both short-term and long-term mortality among patients admitted to the cardiac intensive care unit. We examined 9,500 Mayo Clinic cardiac intensive care unit patients and found that a lower or worse Braden Skin Score at the time of admission was associated with progressively worse hospital and post-discharge outcomes. We observed a strong association between the Braden Skin Score and hospital survival even when we adjusted for illness severity and multiple other factors, and patients with an admission Braden Skin Score of 15 or below had markedly higher death rates regardless of age or illness severity. Among patients surviving to hospital discharge, those with a lower admission Braden Skin Score were more likely to be discharged to a skilled nursing facility and were more likely to die during follow-up, even when we adjusted for known predictors of mortality. Our study specifically highlights the prognostic impact of the routinely available Braden Skin Score and points to the importance of bedside nursing assessments for risk stratification, even among critically ill cardiac intensive care unit patients. The Braden Skin Score is routinely documented throughout hospitalization for patients nationwide and captures 6 domains that predict pressure ulcers, namely the ability to communicate, nutrition, skin moisture, activity level, and 2 additional measures of mobility. These domains of the Braden Skin Score may provide insights into frailty, which reflects the combination of age and comorbidities that can limit a patient's ability to recover from illness. Frailty is an important determinant of outcomes among both critically ill patients and among patients with cardiovascular disease. The idea that a simple score that is calculated by bedside nurses every day can robustly predict both hospital and post-discharge outcomes emphasizes how important multidisciplinary care is for our complex cardiac intensive care unit patient population. In this way, the Braden Skin Score may quantify the eyeball test that experienced clinicians often use intuitively in prognostication. Recognizing that a cardiac intensive care unit patient with a low Braden Skin Score may be frail and is at elevated risk for adverse outcomes offers an opportunity to intervene on their behalf. Understanding the potential contributors to their low Braden Skin Score may help the multidisciplinary care team to better anticipate possible complications and to treat any reversible conditions in order to improve outcomes. The Braden Skin Score might also be able to predict which patients are more or less likely to tolerate the aggressive supportive therapies that we employ in the cardiac intensive care unit. This study opens several exciting avenues for future research, starting with gaining a better understanding of which Braden Skin Score domains are most important for predicting outcomes in cardiac intensive care unit patients, and whether a low Braden Skin Score truly represents frailty. While frailty is a well-recognized risk marker in a variety of clinical situations, tools to quantify frailty are limited and often harder to assess than the Braden Skin Score. We have an opportunity to determine how to incorporate the Braden Skin Score into initial assessment and clinical decision-making, including the identification of patients who may benefit from a specific intervention, or who may benefit from early engagement of support services such as physical therapy, nutrition support, and even palliative care. We hope you enjoy reading our article and can find novel ways to incorporate the Braden Skin Score into patient assessment in your clinical practice.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.